Talking about the grade of baldness and depending upon what is required as what grade is very important, whether you need hair loss medicines or you require transplant or both. My name is Dr. Desai. I am a board certified cosmetic and plastic surgeon practicing in Mumbai and Pune. I have over 20 years of experience in treating hair loss and hair transplants. Now let's talk about the grade of baldness and at what step, at what stage, what treatment would you require. Okay. Grade 1. Grade 1 is when you lose hair, just start losing hair from the front and may lose little hair in the crown on the top. This is grade 1. Do you need a hair transplant at this stage? No. At this stage, you need medical management of therapy in order to stop the hair fall so that you don't progress to the other grades. Grade 2. Grade 2 is when you lose little more in the front, mainly in the temple areas. Hairline may go back slightly or you may have a small patch developing here in the vertex. That is grade 2. Do you need a hair transplant at this stage? In most of the cases, if you are over the age of 35, 40 or 45 years, this is okay, this is natural. You may not need a hair transplant unless you are very bothered about your looks, then you may need a little bit of correction. Do you need a hair transplant if you're facing camera or if you're an actor? Yes. That is where I'm saying profession matters, what a patient does matters. So yes, grade 2, either you may or may not do hair transplant depending upon the requirements and the profession of the patient, but definitely you need to preserve hair fall so he doesn't keep progressing, because from grade 1 to grade 2 it's hardly visible, but the moment he goes into grade 3, grade 4, grade 5, it becomes even more visible. Now what is grade 3? Grade 3 is when your hairline definitely goes back, the temples go back significantly, maybe you start developing a nice patch in the center out here, or in the vertex the patch is increasing. That is grade 3. Do you need a hair transplant at this stage? In most of the cases, yes. Unless you are 50, 60 and you are saying, okay doctor, I'm okay with so much loss but I don't want more hair to go. In that case, you need to start hair fall and hair loss treatments to prevent further loss, but you may or may not require transplant. If you're in a younger age and you're grade 3, you definitely need to look at a hair transplant, because not having a good hairline makes you look older for sure. So yes, you need a hair transplant if you are definitely in early 30s or in up to 40 or even definitely in 20s. So depends on your requirement, you have to understand. Now when we talk about grade 3 vertex, I've already discussed this, means the loss is mainly in the crown. Yes, you may avoid a transplant if you don't have much loss in the front, because your hairline is maintained, hence your youthful look is maintained and you have some loss here. You may still manage with medical therapy. You may not need to rush into hair transplants. Now as you progress into grade 4 and grade 4 crown, as you can see that there are advanced stages where your front is nearly gone, your crown is increasing, or there is a patch in both the areas, you definitely have to look at a hair transplant. Okay, grade 5, the progression is too much, you need a transplant, and grade 6, grade 7 also need a transplant, but it may be difficult many times to do it in grade 6 and grade 7, especially in grade 7, because there may not be enough of donor area. Up to grade 4, grade 5, donor area may be sufficient to cover up the entire scalp, but when it goes to 6, 7, then the donor, along with that you may need beard and body hair to cover up the scalp, because the graft requirement is much higher. So now what is the graft requirement? If you're talking about grade 1 and if somebody is very vain and he wants a good hairline, a natural hairline, he may need not more than 800,000 grafts. If he's grade 2, maybe 1,000, 1,500 grafts is what he may require. If it is grade 3, 2,500 to maximum 3,000 grafts is what he requires. If it goes to grade 4, definitely the graft requirement increases to 4,000, 4,500 or maybe even 5,000. Grade 5, 5,000 to 7,000 grafts is the requirement in most of the cases. Grade 6, grade 7, the graft requirement is far over 6,000. It goes in the terms of 9 to 10,000, even 12,000. Hence, donor alone cannot be, the donor hair itself from the scalp is not enough. You need body and beard or any other part of the body which is required. So hence, Do you want to come to a doctor when you are at this grade? No. You should try and come and see a doctor at this stage so that he prevents you, gives you proper medication and prevents it from going to these severe grades. So that is why come early, start hair loss treatments early so that you don't progress to these grades. When you're also in the early grades, the number of graft requirement is less and hence you can get a more better result, better density and more natural growth. As we discussed about male pattern baldness and grading and how to treat them and what is required at each stage, similarly you have to look at a female pattern baldness or a female androgenic alopecia or patterned hair loss in women and how to treat it. Now in women, the causes of hair fall are very different from men. You must do hormonal tests, thyroid, PCOS profile, B12, calcium, ferritin, CBC, and make sure that there are no hormonal or mineral deficiencies or other problems before you treat her, because otherwise you will never get the right results. Hence the correct investigations are very crucial before actually doing a treatment in women. Now women have grade 1, grade 2 or very advanced grade 3. Now at grade 1, what do you see? You just see widening of the partition line or little bit of receding in the hairline. That is grade 1. At this stage, medical therapy is extremely important so that she doesn't lose more and you may not need to do a transplant. Grade 2, when this widening is significant, it's significantly visible and the hairline is going back, especially from temples and in the center. In this case, definitely you need medical therapy so that she doesn't go into more advanced stages of baldness. But at the same time, you may need to do a transplant. How much is the graft requirement? Between 2 and 3,000 roughly is what your graft requirement is. And grade 3, when you have very less hair in the top and center, and of course the hairline is going back and the center looks quite empty. In such cases, you make sure you rule out other causes. It's only female pattern loss. Control the hair fall, improve the quality of hair with medical therapy, and then do a hair transplant if the hair are healthy. Okay, what is the requirement? 4 to 6,000 grafts, or even maybe sometimes 7,000-8,000 grafts may be the requirement, but most of the cases they do well with 4 to 6,000 grafts. Hence, choose the right candidate properly. Also, hence that is why the importance of choosing the right doctor, because the right doctor will give you the right advice at the right time, at the right stage of baldness when you come to him. If you do like this video, do like it, share it amongst your friends and colleagues, educate them, because there are a lot of myths, there are a lot of misunderstandings about hair transplant which I have seen over the last 20 years. So please do follow it. Go through my website and or call us and book an appointment to understand more. Thank you.